Pocket.com.
Mendez of the Philippine Star. With the vaccine rollout, when will the IATF allow children age 14 below and senior citizens to go out their homes for leisure and travel purposes? What will be the considerations for the government to lift the ban? Thanks.
Well, sa travel and leisure, no, this is something that the president has already delegated to the Department of Tourism, and the Department of Tourism now is very busy in creating tourism and travel bubbles in different parts of the country. But the DOT can only do so much because lahat naman yan ay nakalatag na and they're ready to partner with the LGUs. So necessarily, we will need the LGUs to say yes to the DOT. But as soon as the LGU agrees to create a travel and tourism bubble in their locality, the DOT is ready to work with them and create that travel bubble. So it's really a partnership, no? The DOT cannot do this unless the LGU accepts the help of the DOT and collaborates with the DOT in that regard. Napag-usapan din muli yung kagabi yung tungkol sa face-to-face classes, no? So again, the president reiterated his stand that he wants to see a more rigorous, a more widespread rollout of the vaccination program. Ang sabi nga niya is that unless he sees about, he gave a figure like 2 million vaccines being rolled out, no, as a start, then that's when he will start reconsidering about itong pagbubukas more openly ng ating GCQ areas to consider again putting it under MGCQ, and dun sa limited face-to-face classes. Ang napagkasunduan kagabi is that yung limited face-to-face classes will only be pilot classes to be selected very carefully by the Department of Education. Doon sa mga areas na mababa ang transmission rate ng COVID, na mababa ang kaso ng COVID. So these are just pilot, limited face-to-face classes. And in fact, even some private schools have also reached out to DepEd and asked also that kung maaring sumama rin sila sa mga pilot programs ng DepEd for limited face-to-face classes. But again, the president still wants to see a more massive vaccination rollout for him to gain enough of that, yung kumbaga yung kumpiyansa, tumaas yung kumpiyansa niya na pwede nang mag-open ng limited face-to-face classes ang DepEd. Maging dun sa mga GCQ areas na bubuksan muli for MGCQ.
Thank you, Kabsec. Questions from Heidi Sampang of DZAS. Ano po ang posisyon ng Malacanang sa no vaccine, no work policy? Ipagbabawal ba ito ni Pangulong Duterte?
Si Pangulong Duterte has always said, no, na hindi natin ipipilit ito, yung vaccine sa ating mga kababayan. So, walang pilitan yan. Although, syempre, tayo po ay laging nananawagan sa ating mga kababayan. At sa nakita naman po natin, tumataas naman po ang kumpiyansa ng mga kababayan natin habang nagro-roll out tayo ng vaccines. Sa una nga po, may mga agam-agam pa maging sa health and medical sector po natin. Hindi naman po lahat ng mga healthcare workers on day one ay agad na pumayag, no? Pero habang nagro-roll out ng vaccine at naumpisa na nga po, tumataas din yung kumpiyansa ng ating mga healthcare workers. Kaya nga po marami na rin pong mga hospital, maging ang private hospital, ang nag-reach out ngayon sa mga vaccine cluster head at ang ating vaccine cluster na humingi rin sila ng kanilang allocation. So ibig po sabihin, maging yung demand for the vaccines ng Sinovac ay naging mataas na maging sa mga healthcare workers. So ganoon din po ang mangyayari for the rest of the population. Habang nakikita nila at kami nagpapasalamat ng lubos sa media, no, sa wide coverage, pagko-cover ninyo ng lahat ng ginagawa nating vaccination rollout. Dahil nakakatulong din ito in terms of transparency at nakikita ng ating mga kababayan na maganda naman ang rollout, mabisa, safe at wala naman nakikitang really fatal na adverse effects. May mangilan-ilan dyan pero very, very, very minor. Kaya nga po, again, walang pilitan para kay Pangulong Duterte. Although, talagang ine-encourage niya at ine-encourage ng buong gobyerno ang lahat ng mga kababayan natin na pagdating ng oras, takdang oras na kayo na rin po ay susunod at nasa linya na nga po na papabakunahan, tanggapin po natin ito ng buong loob at walang pag-alinlangan.
Next question will come from Trish Terada of CNN Philippines. Trish?
Hi, good morning, Captain
Morning,
and
Trish.
Asik JV. Sir, first question, just a clarification. So by mentioning this limited face-to-face classes, you mean you're just saying this as a proposal of DepEd, no? But it isn't necessarily happening soon until mangyari yung 2 million vaccination rollout.
That was the indicative number that the president mentioned, no. It's something that he is, well, to us it means like it's like a baseline for him, no. Unless he sees that going on, then that's the only time that he will start considering it. On whether or not he wants a bigger number of a rollout, well, it's really up to him to decide. But it was well explained naman na this is limited, it will be piloted. There are a number of schools and LGUs that have already agreed. There are a number of public schools, principals, the parents, the teachers, the students even who have agreed to be part of the pilot. But even so, si Secretary Briones said that she may still even cut down on that number just to make sure na merong talagang selected na pilot areas. But again, the President said na let's have a massive rollout first. So no, it's not happening anytime soon. But we expect, no, to have a lot of we're already 600,000 vaccines from Sinovac. We're receiving almost 500,000 from AstraZeneca. For this month of March, Secretary Galvez has committed that we will get within the month of March ang 1 million doses from Sinovac again. And we have, as he mentioned already, a budget for that na allocated, and we'll be purchasing that 1 million worth of Sinovac vaccines. So that means by March we will have almost 2 million, no? And then that ends our first quarter. Hopefully we'll get even more if meron pang darating na bago, because si Secretary Galvez, remember, is flying to India. March 9 to March 12 he'll be in India to solidify our supply agreement with the Serum Institute of India. And we'll see, no? Tingnan muna natin kung darating ba yan ng first quarter or what's remaining sa first quarter or by second quarter. So abangan natin anong mangyari sa March, and then by second quarter presumably we'll have more than 2 million already vials coming in. So baka yun yung parang indicative timeline na sinasabi ni Pangulo, at kaya nasabi nga niya yung 2 million doses or vials na darating dito sa bansa.
I see. Sir, yung sa AstraZeneca naman po, ibig sabihin, sir, hindi pa po, not necessarily, or from what I understand, NITAG po yung magde-decide, pero napag-desisyonan po ba kung bukas na rin po ba yung rollout ng AstraZeneca? Like for example, Sinovac, pagkadating, kinabukasan rollout agad?
As of the moment, ang alam ko ay nagmi-meeting na po ang NITAG today, no? So let's wait and see. Ayoko rin pangunahan anong maging decision nila.
Sir,
abangan na lang
sir,
natin.
napag-usapan po ba sa cabinet meeting last night, yung South African variant, kung ano po yung magiging steps? What was the initial impression of the president? How does the government plan to contain it? Kasi sinasabi po ng experts na kung hindi natin mako-contain itong South African variant, posibleng masayang po yung AstraZeneca doses natin.
Well, liwanagin lang po natin, no. Yung South African variant or even the UK variant or kung ano man mga variants na alam po natin, yung mode of transmission is still the same. So ibig pong sabihin, to protect against catching the COVID-19, we still have to stick to the same health and safety protocols, no? Yung hugas kamay, social distancing, face mask at face shield. Wala pong pinagkaiba yan. Ang sinasabi lang po nung sinasabi mas transmissible is mas mas efficient yung variant na to in terms of pagkapit niya sa mga cells natin. But in terms of its transmission from one person to the next, ganun pa rin po yung protection natin. I guess what it means is that it only emphasizes and underscores the fact na kailangan po talaga natin ng mas massive at mas mabilis na rollout to protect us, to give an added layer of protection dahil nga po meron tayong bakuna. So yun po ang same na pabalik-balik na sinasabi po natin sa ating mga kababayan na kahit nandyan na po yung bakuna, tuloy-tuloy pa rin po yung ating health and safety protocols. Ganun pa rin po, walang pinagkaiba ang transmission yan. Kaya dapat patuloy pa rin. And right now, the LGUs naman are already exercising their localized lockdowns, no? At patuloy pa rin naman ang pagmomonitor ng IATF, maging ang DILG, maging ang Department of Health dun sa mga localized lockdowns na ini-impose ngayon. And also, in addition to that, if you remember in the previous cabinet meetings, napag-usapan din po natin yung mas malawakan na genome sequencing na ginagawa po natin. Kaya nga natin na-detect na may mga variants na ganyan. So, ipagpatuloy pa rin natin at may nakalaan na pondo at pera po dyan para patuloy pa rin yung mga genome sequencing na gagawin natin so that we can detect the presence of these variants in our population.